This week, on the final part, we continue our conversation with Dr. Malani, focusing on the rising concern of kidney disease in Fiji. We'll explore the early warning signs, prevention strategies, and how you can take better care of your kidney health.
Okay, anyway, kidney disease is a growing concern in Fiji. From your experience, what are some early warning signs that people should look out for, and how can they better protect their kidney health?
Kidney disease, they usually progress silently in about 90% of people with chronic kidney disease. They're usually unaware of their condition until they're pretty advanced. And because of that, the importance of awareness and screening, because majority, you hit the rock when you are really gone, the early signs would be change in urination pattern, unexplained swelling of your legs, and I think if you are diabetic or hypertensive or overweight, you are in that zone that you need to be evaluated and managed. And definitely if you've got a family history of kidney disease, then I think those people should be pretty aware that they are at the risk also. So protecting kidney health involves regular health screen, and I think that's one of the things that need to be propped up here is not only awareness and then screening. And when you get screened, and if you are noted to be at risk or you have evidence of chronic kidney disease, you need to be channeled into a situation where you can be followed up and treated accordingly. So there is still that chain that we haven't done properly in Fiji. Assessment is still not really there, and if you also, where does that go to? So that whole chain, I think, need to be improved. In Fiji, about 30% of people are at risk, and because of that, again, there need to be regular check programs. Unfortunately, we are not winning in the figures, and the figures show increasing prevalence of diabetes, and with that increase, all these complications are all going up in the graph. Amputations, eye disease, renal complications, cardiac complications, infections. So all these are continuing to go up, and it hasn't even leveled off, and then going down. So Australia and New Zealand, they're starting to go down the curve. We are still on the upward curve. So we're still quite a long way to go. So the commonest cause of blindness is diabetes. Commonest cause of amputation is diabetes. Commonest cause of heart attack is diabetes. Commonest cause of ESKD is diabetes, and of course infections is so. And then because of that, I always wondered whether we should have a minister for diabetes, because public health campaigns and education can significantly improve awareness and early detection. I think that's an area that we strongly lack and need to be. Whatever intervention is put in will take one generation, and I think that's very important. Don't expect quick buck. And one generation is 18 to 20 years to show some effect. Diet, exercise, smoking, drinking water. And you're talking about diet, and it's the whole things, so that takes another program to address those areas.
Thank you very much. Just before we wrap up, looking ahead, what advice do you have for young doctors or medical students who want to follow in your footsteps and actually make a real difference in healthcare?
So I think in doing medicine in the Pacific and in developing countries, a little bit more different from if you're working in Australia and New Zealand, but I think the principle remains the same. And I think one of the things that I have been come through in the medical school and so forth is for the young doctors is the focus on continuing learning, because medicine is an evolving field, and it's important for them to continue to keep update with the latest research and technologies and best practices. There's also the skill of deep, strong skills in communication, building trust with patient and collaborating effectively with the colleagues. And collaborating with colleagues is very essential. So those are so important. Empathy and clear communications can improve patient outcomes. Sometimes we as doctors, we just think that top down, we just say, do this, do this, do this. I think that need to be developed as they continue to go on, and they must be consistent in strengthening that part of their profession. Prioritizing patient care, and that is the heart of a healthcare, is patient care, and advocating for their needs and respecting their values, and making a large difference in that sort of area. I think embracing, there's all these technologies are coming up, and I think that's also very important. I'm an old man now, and I still very much into AI and getting into the latest AIs and data analysis, so that I can know more of the latest. And advocate for equity, and looking at reducing disparities in healthcare, ensuring quality of healthcare, and particularly in our socio-economic background, where quite a significant number of people are in a poor socio-economic. And I think that is always something we have tried to address is to try and address and having accessibility of health to all our people in Fiji. I think probably the last thing I want to say is, I think for young doctors, they should stay passionate and purpose-driven, because they should remember why they choose their path to become a doctor. It's a very special profession, being a doctor. I always told my people that whether in the ocean, you're climbing a tree, in the desert, you're still a doctor. And you carry yourself like a doctor, and you hold yourself like a doctor. And with that, passion and purpose should sustain them throughout their challenges. And the challenges everywhere in healthcare system are different here and different from, but their passion to serve should always be there throughout their profession. Yeah.
Thank you very much, Mulu. Thank you very much for your time. And to all of viewers, and especially our young ones, remember, it's all about learning constantly, because education is a never-ending process, just like the doctor mentioned. And there's a saying that goes, you give a man a fish, you feed him for a day, but you teach a man how to fish, and you feed him for a lifetime. So from us here at Health Talk with Oceania Hospitals, till next time, Vinaka Vakalepu.